Ahead for us on today's show, Erie County's mask mandate is about to return. We're going to get questions answered on the decision as our cases and hospitalizations are really spiking here in Western New York.
Plus, can a COVID treatment pill replace vaccines? It is a question the Verify team is taking a close look at tonight.
And ready to trot, we're going to have an organizer of the Turkey Trot here tonight to talk about the big race, which returns in just about 3 days' time.
Well, we're glad you're with us, and we're going to start with that news that shows just how serious the COVID surge is getting in Western New York. A mask mandate will go back into effect in Erie County starting tomorrow morning.
County Executive Mark Poloncarz made the announcement this afternoon. Now, this will apply to all public indoor places in the county, so places like stores, restaurants, gyms. And this comes as cases and hospitalizations have been on the climb. So just a few minutes ago, we got this update from the state, and you can see on the right side of your screen, the Western New York region has now surpassed 400 hospitalizations. It's double where we were just a month ago, up a lot over just the past week. And if you compare to where we were yesterday, 20 new hospitalizations just in a 24-hour period. And
it's far worse than at this point just before Thanksgiving last year. The biggest difference is then we didn't have vaccines, but we also didn't have Delta. And last year we trended upward until the middle of January. And we know you've got a lot of questions. So joining us live tonight is Dr. Thomas Russo, Chief of Infectious Diseases at UB's Jacobs School of Medicine. Dr. Russo, we're glad to have you with us.
Glad to be here.
So, Dr. Russo, people are asking, why do this mask mandate now? We should point out, as of the latest numbers, 80% of adults in Erie County have had at least one dose of a vaccine. Of course, that means 1 in 5 is not vaccinated, but many of those people got jabs in order to try to avoid mandates like this. Can you tell us why you think this is the right call, why this is necessary, and maybe address the claims out there? I've heard a lot of them today of people saying that the evidence shows that the masks don't make that much of a difference. What is your case of why this is right?
Well, let's first address the number of those that are protected by vaccination here in Erie County and in our state. The critical number to look at is who is fully vaccinated. If you've only gotten one shot, that offers really inferior protection against the Delta variant, only on the order of 30% at best. And unfortunately, that number here in Erie County is only 63%. So we have a big chunk of the population that's still susceptible in getting infected with the Delta variant. And as the cooler weather has descended upon us, we're shifting indoors. And I think, as we all know, if you go to Wegmans and look anywhere, our mask use has been less than optimal. The Delta variant is going to find you. So this mask mandate will help with that. It's going to protect both those individuals that are susceptible, and it will prevent other individuals from transmitting the virus to others. And I think this is going to help us tamp down the cases as we move forward.
Dr. Russo, we want to show our viewers a tweet today from the Erie County Health Department because it's prompted questions about who is ending up in the hospital. So the county said close to 60% of those in the hospital are unvaccinated. An even higher percentage of those in the ICU haven't gotten the shots. But that means 2 in 5 hospitalizations are vaccinated people. And some use that to say the vaccines don't work as well as expected or at all. Can you address that?
Sure. So to be clear, vaccines are extraordinarily efficacious, and they do a great job in preventing hospitalizations and bad outcomes. I think we need to look at these numbers in 2 manners. First is a bit of a complicated math issue, but as more and more people get vaccinated, you'll have a commensurate increase in the proportion of individuals that get infections and land in hospital that are fully vaccinated. Or to look at it more simply, if 100% of the population was fully vaccinated, all of our cases and hospitalizations would be in the fully vaccinated. So you have to take that math into consideration. Secondly, although our vaccines are great, they are not perfect. And we know lately that we've had some waning of immunity, particularly in our immunocompromised and our most vulnerable and frail seniors. And these individuals with underlying diseases and older individuals are those that are at greatest risk for getting hospitalized, even though they've been fully vaccinated, and therefore the booster is so critical for them. But I think lastly, it's important to note that if you're fully vaccinated, you're much more likely to get out of hospital than those that are not vaccinated.
And Dr. Russo, something that's really difficult as we look at this trend right now is we know hospitalizations are going to keep going up because they trail behind cases, and our cases are still going up, right? So does this seem like a situation where you think maybe we need to consider bringing in extra resources? I mean, the county executive was asked today about the National Guard coming in. The problem with that is oftentimes they're just pulling from other hospitals. I wonder if you would recommend maybe, downstate, where they're in great shape in downstate New York right now. Are we close to a point where you think we may need to bring some of those resources into our region?
Fortunately, we are not there yet. If you look at the total hospitalizations in the winter holiday surge that we had almost a year ago, we had many more hospitalizations than we have at this time, and we were able to handle that. But I think that's why we want to get ahead of this. Initially instituting this mask mandate to try to tamp cases down, and we know if we could keep cases down, then we could keep hospitalizations down as well. And of course, the ultimate mitigation measure, even though masks are great and they've unequivocally been shown to protect against infection, vaccination, though, is still the best measure to protect yourselves and your loved ones.
Looking ahead, the county executive cited you today as saying that you're expecting this wave to continue through January at least, and then potentially burnout. What led you to that projection?
Well, I think we just have to look at data from the previous year, and we knew we had a huge surge at this time last year. We had a Halloween kickoff last year when we had the same kickoff this Halloween, and that's because the weather gets cooler, people head indoors, they celebrate that involves food and drink when people cannot wear masks. This Delta variant is so infectious that we're really going to have two classes of people when this is all over. Those that attained optimal protection from vaccination, which now includes a booster shot, and those that did not have protection from vaccination, and ultimately the Delta variant will find you. And when we have everyone that's either been infected or has optimal protection from vaccination, that's when the surge is going to end. And I think at the rate we're going, I'm looking towards sometime in early 2022 when we'll start to get on the backside of this.
Finally, Dr. Russo, we're almost out of time. Maria Gennaro and I were talking about this earlier today, the importance of testing and getting rapid results. I mean, the county executive said today, if you go to one of the county sites, it's going to take between 1 and 3 days. 3 days is a long time. Are you as disappointed as a lot of our viewers are right now that we as a country, and I guess this is in large measure worldwide, that we haven't put more of a focus on getting rapid test results so that if I think maybe I have this, I can find out quickly and I'm not going to give it to somebody else?
Yeah, we haven't done great with testing. Going back to the beginning of this pandemic, and even now, we could really use an ample supply of inexpensive rapid tests that are reliable. Europe is ahead of us in this game, and they have an ample supply of these rapid tests where people could sort out their status really within a few hours. President Biden is invested in rapid tests, and hopefully we'll have more in the near future, but right now we're not really where we'd like to be with the testing situation.
Dr. Thomas Russo has been our guest. He's the Chief of Infectious Disease for UB. Dr. Russo, thanks again for being here.